I already know her hormones were going to be a shit show because that's a pattern right there. And that's a pattern that's completely missed in conventional medicine.
It is, because all my doctors know my history and no one put that together.
Well, the problem is, Lynn, is they don't know how to test hormones accurately. And even if they had the information, they're just looking at the normal ranges and be like, oh, you're normal, you're fine. They don't understand these patterns that we're talking about that's actually triggering the autoimmunity or the heart attack.
Right.
So if you don't know what to do with the information, why would they even test it? That's the problem out there with the conventional approach. You mentioned data from hormones. This is a very different approach than what you were given up to this point. How was it like getting data around your hormones? What kind of impact did that have on your own understanding and your own empowerment in this process?
That was a huge change for me, because even though I'm 53 years old, no one's done any hormone data for me yet.
That's mind-bloggingly upset for me. When I hear stuff like that, and we hear it every single day when people book a call with us, 99% of women and men have never had a full hormonal evaluation, much less learn what it means.
Exactly. And you guys did a test for me, and I have no hormones. Basically, my hormones are in the toilet. There's like nothing. So it's no wonder that, everything else is screwed up, because there's nothing there to stimulate anything.
Well, I'm going to put a mind blow link right here for people, the patterns I see. So when you have gestational diabetes or type 1 or type 2 diabetes, you literally have an autoimmune attack against a hormone making organ, which is your pancreas that makes insulin. And if you have an attack against hormone making cells, the other hormone making cells all over your body look almost the same to your body. So it's going to be attacking your thyroid, your ovaries, your adrenals, your brain hormone making. So it's no wonder that Lynn had no hormones in her early 50s. She had the hormones of an 80-year-old because it was under autoimmune attack. But I know that because I already know there's a history of gestational diabetes and type 2 diabetes. I already know her hormones were going to be a shit show because that's a pattern right there. And that's a pattern that's completely missed in conventional medicine.
It is, because all my doctors know my history and no one put that together. I was diagnosed with the type 2 diabetes in 2000. So it's been 21 years since I've been diagnosed with type 2 diabetes, and not one of my doctors, not my gynecologist, not the endocrinologist, not the cardiologist, not
all the
none of them said anything about maybe we should check your hormones, because the same thing that's, happening with the diabetes could be affecting other organs.
Well, the problem is, Lynn, is they don't know how to test hormones accurately. And even if they had the information, they're just looking at the normal ranges and be like, oh, you're normal, you're fine. They don't understand these patterns that we're talking about that's actually triggering the autoimmunity or the heart attack.
Right.
So if you don't know what to do with the information, why would they even test it? That's the problem out there with the conventional approach.
Yeah, that's the frustrating thing about it.
Well, and the frustration. So fast forward, let's talk about this heart attack, history of heart attack. Now, once hormones are off, diabetes is also an incredible high risk factor for heart disease and heart attack. But that became an obstacle for you in even getting natural help. Can we talk about how your history of a heart attack was used against you pursuing natural methods?
Yeah, and quite honestly, it still scares me. Once you've had a heart attack, especially when your symptoms are sort of atypical, you're always afraid you're going to have another one. Okay. Even when you're healthy, or at least
women typically have atypical heart attack symptoms. So that's your worry, higher risk diabetes. But how was it an obstacle to you getting natural help or learning some of these other tools?
Well, because a lot of the things that are considered natural and that are better for your system and that can actually help repair and fix things that are going on in your body, you're told you shouldn't do because it's not good if you have a heart condition.
Okay. And this is why it's important to actually work with a functionally trained MD. What did you learn in this program?
Well, I learned that a lot of the things that I was worried about and that I had been told in the past that I shouldn't try, I shouldn't be worried about, because everything that we do in the program is actually designed for heart health as well as pain relief and blood sugar balance and everything else.
Meaning I gotcha.
Yeah.
I got you. I got your back. I'm watching, I'm teaching, I'm training, I'm working with you. And the issue is that so much of what we know in cardiovascular health and heart disease, the data actually, some of it is actually rather damning as well. So you got to balance is that just because something is a medication or recommended by a cardiologist, it doesn't mean that they're all good. And natural methods doesn't mean they're all bad or all good. There's a balance in here, and it's all really important to take a look, work with somebody who knows the difference between the two, but also base it on your data. One of the biggest things people talk about is, will my lab results improve with this program? And there's so many markers for cardiovascular health. There's so many markers for autoimmune disease. And I don't have to say it, our alumni says it, which is when you actually retest these numbers over time, you have a visitor. You're gonna see those numbers improve and improve and improve. So I know you're straight out of the program, but what you're gonna find, this is the super hot man you talked about that you married in 2017.
Yes, that is.
We were talking about you, dude.
She lied. I'm not super hot. I'm beyond my prime. Maybe my birthday.
I love that. But what we see is that not only do inflammatory numbers improve, but we see cardiovascular numbers improve. So you're too early to do the retest, but Lynn, in a couple months, you can redo all those cardiovascular markers and tests. You can thank me later.
Okay. Well, I can tell you for sure that just since going gluten-free on the program,
yeah,
my A1C is down to 5.5.
From where?
When I first started having the issues with the hormones and everything else, I was at 6.1.
Right. So dropped almost 0.6. It's dropped 0.6 points, not even cutting carbs, but just going gluten-free alone, not even talking about any other tools. Okay. Yep. I love that. All right. Question for you. What's something that you can do now effortlessly that 2 months ago you would have thought was impossible?
I can effortlessly now just do stuff around the house. I can pick up the laundry basket and take it from room to room if I need to. And I can be myself. I can do everything around my daily life that I couldn't do before without pain. Literally everything that I did caused the pain to be worse.
I get
Even
it.
just driving to and from work was some days phenomenally painful.
Woman, I've had 2 neck surgeries, dealt with chronic pain, diagnosed with fibromyalgia as well. And just like having that chronic neck pain, I couldn't turn my neck fully, got me into 3 additional car accidents within that 2-year time frame.
Yep.
People don't realize the impact. Like you talking about just driving. Driving requires you to turn your head fast.
Oh, and it wasn't just that. I would get tensed up behind the wheel. Mm-hmm. I would get so worked up and stressed out driving the car that I would get home and I would be all clenched up and everything would hurt. My neck would hurt, my shoulders would hurt, my chest would hurt, everything hurt.
What do you think the impact has been on your relationships as a result of some of the health changes in you?
Well, for sure, my husband, who you just saw, is noticing that I'm getting back to my old self, which was part of why I wanted to do the program, is that I didn't feel like I was giving him or my stepsons my best me because I didn't feel like me anymore. I was in so much pain all the time and I was so agitated. My fuse would be so short because everything just grates on you when you're so tired and the pain doesn't go away. You don't get any relief from the pain. Yeah. It's really hard to be patient, to be kind. I mean, you know all this. But it's incredible getting to feel more like myself again, especially women. But I think a lot of people have a problem with putting themselves first
100%.
Because they're so worried about taking care of everyone else. Mm-hmm. I mean, after I had my heart attack, that was one of the things that I had to learn, which was that if I don't take care of me, I'm not going to be around to take care of anybody else.
So this is a big mindset shift for you, meaning like the old you would have felt guilty and shameful about doing a medical program and investing in yourself like this. But now that you're at the end of it and you see the results and how much it's been, their lives have improved as a result of it, you realize that actually taking care of you gives you more to be able to give to others. You can't give from empty of nothing.
Exactly. When your cup is empty, nothing's running over.
When you were looking at this program, why did you almost not join?
Like I said, I was afraid of whether or not I was going to be able to do everything in the program, because I have researched things before and been told that there are things that I can't do. And I was really worried that this might be another situation where it sounds really good, but I'm going to get part of the way into it and someone's going to tell me, oh, well, you can't do that part because of your heart condition, or you can't do that because you've got the type 2 diabetes, so you can't take this and you can't take that. And so that was one of the biggest obstacles that I had to push myself past and take a chance. It was really a leap of faith.
Yeah.
That I was just going to say, I'm going to try this and I'm going to hope for the best, and fingers crossed.
That was your biggest fear, was what if there were my own limitations where I wouldn't be able to participate in this program fully?
Right.
What did you learn in the program about that? What's your answer to that fear?
Hell no.
I love you.
I learned
Hell no.
Hell no. It's just not true. I mean, there hasn't been anything that I haven't been able to do so far. And even though that I was scared to do some of it and to try some of it, I pushed myself past that, and it was worth it because it's working.
It's working. And the other thing is, you can have faith and trust in someone that actually knows what the hell I'm doing to be able to tell you yes, no. And I can tell you 99.9999% of everything in our program has been a hell yes for you to be able to do. I don't know, there's a 0.1 even that you can't do. But I think for me, being able to be that voice of certainty and confidence for you, even if you have to borrow it from me, it's fine. It's cool. That's what I trained for.
Right. And I think that's the scariest thing. I mean, that would be one thing that I would tell people if they're nervous or they're afraid to take that leap. It's worth it. Do it. Dr. Maggie knows what she's talking about, and she's not going to let you fall. She's the safety net.
I got you.
She's going to make sure that you succeed in this program.
Thank you for joining me on this interview with Lynn. And I think several things really struck me about Lynn, which is that it's really common for people to use fear becomes an obstacle for them. So because she's had a heart attack, she was scared that she wouldn't be able to do all these natural and holistic tools that are the very thing that could help turn her around, not only the cardiovascular disease, but with her autoimmunity. So her fear and what she was told by her regular doctors became an obstacle to her getting the real answers and results. So it was fascinating to me that I love being able to be a functional medicine MD with all the MD training and all the functional medicine training, and be able to be a voice of authority and confidence for people in our program. So we can, when I asked her, I was like, so what happened with that fear? Is there anything you can't do? And her answer was, hell no. I love that. So that's what I love most about Lynn's fear, and the answer to that. The answer is confidence and authority and support from someone mentorship, powerful mentorship with true sayers. I think that's the answer to that. So if you're loving everything that you see in this interview, go ahead and join our Facebook group, Transform Autoimmune Disease Naturally. There are hundreds of client interviews in there, all with different autoimmune journeys or not. And there's also tons of free bonus trainings in there in the group, and community support. If you can join that, that'd be great. If you're watching this on YouTube, please subscribe, give us a thumbs up, help us with the algorithms on YouTube. And in IG, go ahead and just follow us. And we have tons of content in there as well. Thanks, everybody.